Thank you for joining us for Talking Sleep, a podcast of the American Academy of Sleep Medicine. I'm your host, Dr. Seema Khosla, Medical Director of the North Dakota Center for Sleep in Fargo. Today's episode is sponsored by Apria. Many of us care for veterans, either through our work at VA facilities or in our own hospital or private practice systems. We have all met those who struggle with their sleep due to PTSD, whether this is an inability to use PAP therapy, nightmare disorder, insomnia, or insufficient sleep due to delayed bedtime and sleep-related anxiety. Veterans certainly aren't the only people who have PTSD. Data from the National Center for PTSD indicates that 6% of the U.S. population will experience PTSD at some point in their lives, and that women are more likely to develop PTSD at 8% versus 4% for men. Dr. Maya Schenker studies the bidirectional relationship between sleep and PTSD. She is a postdoctoral researcher at the Better CRE at the University of Melbourne in Australia. Her goal is to find ways to prevent and manage PTSD by targeting sleep as a modifiable etiologic factor. Thanks for joining us today.
Thank you so much for having me. I'm very excited and honored to be here.
Well, so let's dive in. Let's talk about PTSD. How does this develop?
So PTSD can develop after we experience a traumatic event. It's actually quite common for people to experience trauma, and the general population is estimated, or about 70 to 80% of the general population is estimated to experience at least one traumatic event in their lives. So it's most of us will experience at least a trauma.
That's high.
It is high, but if we think about it, what is a potentially traumatic event? The pandemic could be one of them, and all of us experienced a pandemic. So potentially traumatic events can be anything that poses significant threats to the person's physical or psychological well-being, which the pandemic has potentially done, or something that can be life-threatening, like, for example, an accident. But we would only talk about a traumatic event if people experience post-traumatic stress symptoms afterwards. So to be diagnosed with PTSD, the symptoms have to persist for a while. So the cutoff would be 1 month. And there's different types of symptoms that people would experience, like intrusion, so flashbacks, nightmares, avoidance of places, peoples, or thoughts related to the trauma, hyperarousal, which includes sleeplessness, so problem sleeping, irritability, or being easily startled, and also negative cognition in mood, and like depression or also memory deficits.
So tell me about your study on college students.
Yeah, so we were interested. We know that there's a strong bidirectional relationship between sleep and PTSD. So we were interested to see if we can see that on a daily basis. So thinking about if we sleep worse, do then people with PTSD or PTSD symptoms have elevated symptoms the next day, and also vice versa. If they have higher symptoms during the day, are they going to experience more disrupted sleep during the night? A few studies have looked at that, and they have found a strong relationship. But what we were really interested is also, can we see this in objective sleep using actigraphy? So we measured sleep subjectively using sleep diaries, but also at the same time objectively using actigraphy watch over 1 month. So we found what we expected, that if people had more disrupted sleep during the night, they experienced higher PTSD symptoms during the next day. But that was basically only in the subjective measures. Objectively, we didn't see a relationship from day to day. But what was interesting about that study is we also looked across the whole duration of the study, whether there was a relationship between sleep and daytime symptoms just in general. And in the objective measures, what we actually found is that if they had better sleep in general, they experienced worse PTSD symptoms in general, which was the opposite of what we found in the subjective measure, and also not what we would expect. So that was quite fun to see.
So objectively then, they slept. So that's interesting. That is the opposite of what we would think.
Yeah, I do have to mention here that data was collected during the COVID-19 pandemic,
Okay.
and here in Melbourne. And I don't know if you've heard, but we had one of the worst COVID lockdown measures here, I think, worldwide, or the longest at least.
Okay.
So that's our claim to fame. And the population that we studied were university students. So the university was all closed. Everything was working from home. They did all their studies online. So maybe that means that objectively we picked up better sleep, but at the same time, people were stressed, and that might have elevated their PTSD symptoms. And that might be one explanation of why we found this.
Well, I was kind of wondering how you study PTSD in college students. That's not the group I think of when I think about PTSD.
Yeah. So we studied them all remotely. So we didn't give them an official diagnosis. It was all based on self-report. But just looking at cross-sectionally about at this population, it is roughly about 50% of the students that report having experienced a traumatic event. And that was at the University of Melbourne. That was in 2 different studies, different times that we saw this. But there was also another sample in the US. So it seems to be quite consistently that there is quite high trauma exposure, even in this younger population. And I think it is potentially due to the fact that a lot of people experience their first trauma during childhood. So, and then at the same time, this young student population, they might not focus on their sleep health. They might not worry too much about it. They're more concerned about good grades and staying up all night studying. And that might contribute to also a bit higher PTSD symptoms compared to other general population samples.
Because they're not sleeping as well.
Yes, they're not worried about it too much.
So then what was your conclusion with your study on college students?
Yeah, so we found that an increase in subjective total sleep time predicted a decrease in PTSD symptoms during the next day, but also a decrease in sleep onset latency predicted a decrease in the number of intrusions that they experienced the next day.
Do you think that's because of sleep pressure?
Maybe, but I think with a lot of that stuff, because it's a subjective measure, because they felt like they slept better, or it was easier to fall asleep, and they had longer sleep, that had then an influence on the next day's symptoms.
So it's more like how they determined that they slept well was because they had a shorter sleep onset latency. Yeah, that's probably one of the factors. Yeah, that's fair.
And it is from the sleep diary, not the actigraphy.
Yeah, the subjective. Yeah.
Yep.
How does sleep impact fear conditioning?
Yeah, so we think that the fear conditioning and the extinction learning processes are underlying the PTSD development. And a lot of studies have looked into whether there's a relationship between sleep and fear memory and extinction memory consolidation. And they have found that there is a strong link there. So it seems like fear memories and extinction memories, they get consolidated during sleep. But not only that, also sleep, the baseline sleep, before people learn the fear learning and extinction learning, has also an impact on it. So it's not just the consolidation, also then it has an impact on the learning phase.
Okay, so that's interesting. So the sleep prior to the traumatic event can impact whether
absolutely.
they have... Oh, that's interesting. Will impact whether they develop PTSD or not.
Yeah, so if people have already disturbed sleep and then they experience a traumatic event, that can increase their risk to develop PTSD.
So does REM sleep have a role in PTSD?
Absolutely, yes. REM sleep is that sleep stage that we think is especially important for the consolidation of emotional memories. So it's not really surprising that there's also a lot of evidence showing that REM sleep, or especially disrupted REM sleep, might be a contributing factor to PTSD. But if we look, there is a recent meta-analysis that looked at differences in sleep between individuals with PTSD and healthy controls. And they actually didn't see that there was a significant difference in REM sleep. But they did do some additional analyses, and they saw that reduced REM percentage, they found that in the population that was younger, so up to 40 years of age. So potentially REM sleep is important for the initial part of the PTSD development, but later on it might go back to normal and is less important. But it seems to be important for the development.
So is it, what about REM? Is it, I heard you say percentage. Is
Yes.
it, so duration of REM or REM density, or what is it?
If only we knew. There was a previous meta-analysis that also looked at the studies, but included a few less studies, and they saw that higher REM density in PTSD compared to controls. But the newer meta-analysis didn't report this finding. I'm convinced that it's probably not just the amount of REM. Usually things are not that simple in life.
Right.
But what exactly about REM sleep it is, or maybe it's a combination of all, or even how we go through the cycles during the night, so the amount of slow wave sleep before REM sleep, so that interaction might be important. But yeah, we can't answer this question with certainty yet.
So I read an article the other day, and I have to ask you about this because I don't know what to think of it. So they talked about that there were lower neurotransmitter levels that were linked to then the brain's ability to inhibit fear expression cells through rhythms that were sent from like the prefrontal cortex to the amygdala. And so then they kind of had this group of people with PTSD, and they needed higher frequency rhythms to extinguish fear memories when they were compared to control. And so then they said, okay, well, the brain's not doing this on its own. And they were working on auditory stimulation to treat PTSD. Is this something plausible?
Yes, absolutely. I hope. We haven't tested it yet, but there is more and more research coming out recently about auditory stimulation. And it does seem to have also an impact on REM sleep, increasing REM sleep rhythms, I think especially REM theta. And it does seem to work, that we can manipulate REM sleep, but we don't yet know if it can have a positive impact on PTSD. I think I'm not aware that there's many studies that looked at emotional memory, maybe even in the healthy control populations, if we can manipulate REM sleep and emotional memories. But it's certainly a space that we can watch, and I'm sure there's more coming out within the next years.
Is there anything that we as sleep clinicians can give to a patient who maybe just had some sort of traumatic event to then prevent that trauma from imprinting?
So right now we don't have any evidence for any hypnotics, for example, to help with PTSD or trauma memories. There is some evidence for more psychological interventions such as CBT or also PTSD, like debriefing or exposure or EMDR. But not really any evidence for any pharmacological intervention. But there is an interesting study that has been done using Tetris as a way.
Tetris the game.
Tetris the game, yes.
Okay.
To let people play the game after they've experienced a traumatic event. So it doesn't have to be Tetris, but any task with high visual spatial demand. Okay. And studies have actually found that it can reduce the amount of intrusions that people experience. So those flashbacks of the traumatic experience, which is also one of the drivers that can lead to PTSD, because it kind of brings back, constantly brings back those trauma memories. And And also reduce the risk for PTSD development. There is some evidence there.
Was that the one that they were giving kids iPads? Like the police were giving the kids iPads after they'd had some sort of traumatic event?
Maybe.
Okay.
I think I remember where they, after accident, potentially gave them the patients Tetris to play in the ambulance on the way to hospital.
Maybe that's what it was. What about benzodiazepines? Would that help?
So benzos are actually contraindicated for PTSD. They can make things worse. There is some evidence showing that giving someone benzos after they experience a traumatic event can increase the risk of developing PTSD.
Really?
Possibly through the underlying mechanism. I think benzos also can impair extinction learning. So the person learns to, or is impaired to learn that they're not in the dangerous situation anymore. And I think there's also some evidence suggesting certain types of benzos at least can reduce REM sleep. So again, maybe it was through the consolidation pathway that it can be detrimental. So yeah, certainly stay away from benzos if you've experienced a traumatic event.
So it came up actually for us personally. I have a friend whose kids were near a school where they had a school shooting, and there was this conversation about what can I do to help my kid not develop PTSD from this. And it was a conversation about, well, wasn't there a study on some sort of hypnotic or something? And unfortunately, it's a question that comes up not uncommonly where we are.
Yeah, that is unfortunate. But yeah, like I said, at the moment, there's no good evidence for any hypnotic for PTSD prevention. But certainly, just in general, looking after our sleep can be helpful, making sure that we get enough sleep, but also with people that have experienced a traumatic event, giving them the space to talk about it if they need to, especially if it is your family or someone from your family that is affected, and also maybe keep an eye out on if they do develop some PTSD symptoms to get help. But then also, in having said that, it's completely normal that if something like that happens to us, that we do have some PTSD-like symptoms initially. That's completely normal. Maybe it would be even weird if someone did not have a stress response to such a traumatic experience. But yeah, if it is ongoing, certainly, and it doesn't go away over time, then certainly, seek help.
So what about other medications like suvorexant?
Yes, absolutely. So there is emerging evidence for suvorexant to be helpful in PTSD. There have been 2 recent studies that looked at whether suvorexant has a positive impact in individuals with PTSD or trauma-related insomnia. And they did find positive findings. So they found that REM sleep did increase, and also was associated with a reduction in PTSD severity, and also some benefits from PTSD treatment related to suvorexant. So there were positive findings, but it's interesting that you mentioned it because I just finished a pilot study more looking at the underlying mechanisms to see if suvorexant can help with extinction learning and extinction recall. But we did use healthy controls. And yeah, we weren't able to manipulate REM sleep in the healthy controls because they probably already had appropriate amount of REM sleep. So there was just a very small margin to play with REM sleep. But we did find overall that greater REM percentage was associated with better extinction recall.
So no benzos. Maybe suvorexant.
No benzos. Maybe suvorexant or
and
any
Tetris.
Other Dora. And Tetris, yes.
And Tetris. Yeah. So let's take a short break. And when we come back, we'll talk more about the relationship between sleep and PTSD. You're listening to Talking Sleep from the American Academy of Sleep Medicine.
Dive deeper into the future of sleep apnea therapy with the Apria Sleep Care program. Once we receive the PAP referral, our team springs into action, offering patients a seamless transition into therapy. Patients start by selecting how they want to begin their sleep journey: in-person care, virtual care, or self-directed care, with ongoing therapy support, including coaching, digital resources, and video assistance, we're committed to ensuring every patient's success. We stay connected with our patients with live calls, texts, emails, and IVR, all designed to make adherence a breeze. And with our supply schedule program, replacements are delivered like clockwork. Experience the difference of an enhanced sleep therapy program with Apria Healthcare. Discover more about our innovative sleep program online today at apria.com.
Welcome back to Talking Sleep. We're talking with Dr. Maya Schenker about how sleep may influence PTSD. So, why are women more prone to PTSD?
There are multiple reasons why this could be the case. So one of them is that there is differences in what type of trauma women and men generally experience. For women, they're more likely to experience interpersonal violence or sexual assault, sexual abuse, which are linked to a higher risk of PTSD development. And men, on the other side, are more likely to experience more like situational trauma, such as accidents. So that can be one explanation. And another one is also differences in sex hormones. So estradiol and progesterone have been linked to fear memory learning and also trauma, response to trauma.
Okay, so if you then give someone exogenous hormones, does that influence fear or extinction learning?
Yeah, potentially. So with the differences within the menstrual cycle, so when estradiol is high or low, depending on where you are in the cycle, studies have found that extinction recall is better or worse. So it might also have an effect on how we respond to trauma, but also therapy such as exposure therapy. And similarly with progesterone, so there was a study and they found that I think increase in progesterone during trauma increased the risk of PTSD development through overconsolidation of the trauma memory. With the exogenous hormones, there was one study that I remember. I think women who were on birth control or they received emergency contraceptives at the hospital following a sexual assault, they had better outcomes compared to naturally cycling women.
Huh.
So there's certainly a possibility there, but yeah. We need to study it more.
So, you talked about improving sleep, right? Kind of making sure that people sleep better around the time of trauma. So by this, do you mean longer duration of sleep, less sleep fragmentation? I mean, what are we looking for?
I think just in general, better sleep is a good starting point. Again, similar to what about REM is it that's related to PTSD development or PTSD in general? We just don't know exactly yet what about it is, and probably it's also a bit a mix of all. But certainly any kind of sleep interventions like CBTI can help to improve sleep and help to reduce PTSD symptoms. But exactly what we have to focus on improving, we still have to figure out.
So I wonder, do they do CBTI combined with behavioral therapy for PTSD? Is that part of treatment of PTSD?
It certainly should be. I think there's more and more a focus of integrating sleep treatment into PTSD treatment. There's also this discussion around the order, whether we focus first on sleep and then PTSD treatment or vice versa. It seems to sleep interventions seem to have a very strong positive effect on PTSD symptoms, meaning that after sleep intervention, if we just focus on sleep, PTSD symptom can reduce as a result of it. Whereas when we focus on PTSD treatment first, sometimes sleep problems can be a residual symptom and then lead to relapse or contribute to the relapse of PTSD symptoms. So it certainly should be an important part of PTSD treatment.
We run into this, not uncommonly in a typical sleep medicine practice where you have someone who has PTSD and that makes them unable to utilize their PAP device. I've a lot of patients that say, boy, this reminds me of being in the military. Can't do it, can't do it, can't do it. And so we've tried to work with behavioral therapy and really trying to obviously different, oral appliance or something else to treat their sleep apnea. And even just talking to the patients, they kind of understand that the PTSD is preventing me from treating my sleep disorder. My sleep is getting worse, and that's making the PTSD worse. And I think sometimes for those patients that are kind of stuck in that cycle, it can be a very helpless feeling.
Yeah, absolutely. Yeah, I totally agree.
And so hearing you say things about suvorexant and CBTI, to me makes me feel like, okay, this is, something that, because we always want to be able to help our patients, right? And offer them something.
And I can also imagine focusing on sleep can be less daunting, especially if that's the first time you have experience with therapy, than diving straight into PTSD and the trauma that someone experienced. So it might be maybe a soft approach to therapy.
That's a good point.
Easier access point.
Yeah, you're right. That's a really good point. I read another article about how subjective sleep improvement is more important than objective sleep improvement. And that kind of echoes what you found with your college students.
Yeah.
And so I feel like this is, and I think it came up with a pharmaceutical, like some sort of hypnotic, and they found improvement in objective sleep measures, but not subjective. And that was deemed a failure.
Yeah. Yep. I absolutely agree that subjective sleep improvements are important, and maybe more so important than objective improvements. I mean, objective sleep measures might be important for the underlying mechanisms if we think that REM sleep is important for the consolidation of the trauma memories. But overall, if our sleep doesn't feel refreshing, it doesn't really matter how well we slept, or maybe we also slept objectively well enough for what we personally need. As long as we wake up refreshed, that is what's important. And then going back to the study, we did use actigraphy to measure sleep objectively. And there is the question of how useful is actigraphy, especially in clinical populations, where there is often a discrepancy between what we measure subjectively and what we measure objectively. There's also some evidence, especially around PTSD, that if PTSD symptoms increase, this discrepancy is actually bigger. So the perception of sleep changes more compared to what we would measure objectively.
So and it really makes me feel like then the sleep clinician does have a really important role then for our patients who have PTSD.
Yes, absolutely, yeah.
And it makes me wonder if a sleep assessment is part of whatever happens when people are being evaluated for PTSD.
Yeah, I totally agree. It should be important. Sleep disturbances and PTSD are so highly comorbid. It's about 90%. So basically everyone with PTSD has some sort of sleep troubles.
Well, you've given me a little bit. You've given me a little bit of. I almost feel like I'm more prepared, right? I feel more comfortable talking about the Tetris and the suvorexant. A few months ago, somebody had reached out and asked us if we could start doing just like a very quick, what do you want us to remember? What is the most important thing from this episode? So do you have a key takeaway for us? Yes,
absolutely. So first of all, I think what's important to remember is that trauma is common, and most people, it doesn't matter if it's in research or in the clinical space. When we deal with people, it's very likely that someone has experienced a trauma, and we have to be mindful that we try not to re-traumatize them when we're dealing with patients and participants. Another important point is that there's a strong bidirectional relationship between sleep and PTSD, and maybe a bit a skewed bidirectional relationship, maybe a stronger effect of sleep on PTSD than vice versa. So sleep's important for the development, maintenance, and treatment of PTSD, but also on a more of a macro level, but also on a day-to-day basis, they can influence each other. And then lastly, sleep is a modifiable factor, so we can use it to prevent it, hopefully. And also to improve PTSD outcomes, such as treatment, or just if we can improve symptoms, that I think is already a win.
Well, thank you for joining us today and helping us to better understand the bidirectional relationship between sleep and PTSD.
Thank you. It was a pleasure.
Thanks for listening to Talking Sleep, brought to you by the American Academy of Sleep Medicine. For more podcast episodes, please visit our website at aasm.org. You can also subscribe through your favorite podcast service. And if you enjoyed this episode, please take a moment to leave a rating or review. For more feedback or suggestions, email us at podcast@aasm.org. I hope you'll join us again for more Talking Sleep. Until next time, this is Seema Khosla, encouraging you to sleep well so you can live well.